It's about you and me. Let's come together, positivity. Health is wealth, gotta take care of myself. Cause ain't nobody gonna make the change.
Hello, everyone, and welcome back to Health Talks by YWS. I am Dr. Marsha Lee George, Medical Director of Your Wellness Sources, and I am so excited to officially welcome you to Season 2 of our podcast. Whether you're tuning in from your morning commute, or you're preparing your dinner, or you are just viewing us on YouTube or Spotify, thank you for being part of this growing wellness community. So this season was very thoughtfully designed with you in mind. We, on Season 2, is all about us going deeper than the surface level of advice, deeper than quick fixes, deeper than treating symptoms alone. This season focused on the whole person, wellness, where physical health, mental health, behavior, mindset, and lived experiences intersect. So what's coming this season? Throughout Season 2, we'll explore some very exciting topics. These topics plague a lot of people in the community. They struggle with it. First up on the agenda, we're going to talk about high blood pressure. We're going to talk about cardiovascular risk factors. We're going to talk how to measure your blood pressure, what is high, what is normal. We're going to talk about what are the things that high blood pressure can affect, how it could affect your vision, your heart, it could affect your circulation. We're going to look at diabetes and pre-diabetes. A lot of people are having new onset of pre-diabetes as well as full-blown diabetes, and obesity accompanies that. We're going to also look at men's health. A lot of men is having a lot of problems with erectile dysfunction. They are having a lot of problems with urinary frequency and urgency. A lot of men is having andropause. The same way women have menopause, men do have andropause. They are having central obesity around their midsection. They are getting very weak. They're having difficulty sleeping, irritability, mood swings, and they're having short-term memory loss and trouble focusing. So these are real concerns that we will address in our podcast. Other things are women's health. Women's health is also real. Infertility is on the rise, guys. A lot of women are being diagnosed with polycystic ovarian syndrome, and this is messing with their ability to give birth to a child. Perimenopausal, there's new onset of perimenopausal women at an earlier age, in their late 30s and early 40s. They are having new onset of perimenopause. And this can be a lot of discomfort they can experience from this. Night sweats, their mood swings, difficulty focusing as well, and memory loss. But mental health is real around this season. Seasonal depression in the winter months is real, especially coming around the holidays when your loved one, loved family members are no longer sitting or at the table. How do you manage those grief? How do you pull your family together and really move past the loss of a loved one? How do you deal with trauma, whether it's sexual trauma, whether it's psychological trauma, whether it's trauma you experienced when you were incarcerated, whether it's trauma you experienced where you were in Afghanistan? These things are real symptoms and mental health concerns that needs to be addressed. Because if we don't address the mental health, it sabotages all of our physical well-being. The other thing that is on the rise is kidney damage. In clinic, we see a lot of patients coming up with elevated creatinine, telling us that their kidneys are not filtering well. And sometimes uncontrolled high blood pressure, uncontrolled diabetes. All these things can cause an assault on your kidneys. And for a lot of my guys who like to work out, a lot of my military guys work out, they want to buff up. People want to exercise and buff up with a lot of muscles. Sometimes they take these supplements with creatine in it. And that also can have an assault on your kidneys. So we're going to have some really excited topics, understanding why it's important to monitor with labs, what these labs mean. We're going to dissect these things in these episodes as well. So the common thread that connects every episode this season is all about behavior change. We know that knowledge alone does not create healthy living, but action does. We explore why change is difficult, how habits are formed, and how mindset and stress influence health decisions. But our first episode this season is titled Weight Loss is More Than the Scale, the Psychology of Change. In this episode, we're going to explore emotional eating, identity, self compassion, and sustainable health habits. Why does this matter? It really matters because at Your Wellness Sources, we believe that people do not fail at health. The system failed people. Not having access to health, not having a dedicated medical provider, not understanding why you need to take a medication, why you need to improve your nutrition, why you need to have labs every 3 months, every 6 months. Those are the things that cause our health to fail. So this podcast exists to educate, empower, and help you listen to your body with real intention. So thank you for joining us for season 2. We're going to have a blast, guys. It's going to be so exciting. We're going to learn a lot together. We're going to hear from guest speakers. We're going to hear from individuals about their own healthcare experiences. It's going to be relatable. So be sure to follow us, subscribe to us, and share Health Talks by YWS, powered by Survivor Sources, Incorporated 501c3. You're going to look for us on Apple Podcasts, Spotify, and YouTube. So up next is Weight Loss is More Than the Scale, the Psychology of Change. Health Talks by YWS, because your wellness starts right here. See you guys. Enjoy.
Come on, work it out. Come on and work it out. See, health is wealth. Come on and work it out. You at the gym right now. Come on and work it out. See, health is wealth. Come on and work it out. Yeah. Come on. It's about you and me. Let's come together, positivity. It's about me. Health is wealth. Gotta take care of myself. Cause ain't nobody gonna make the change but me. So let me put in the work and be the best version of me.